Well, tonight we are digging into a first-in-the-nation price cap on a prescription drug. Glad to have you with us as we wrap up this week. I'm Shannon Ogden. Today, Colorado became the first state in the country to set a maximum price that insurers and patients would pay for the arthritis drug Enbrel. Denver 7's Claire Lavazorio looking into the impact this will have on patients and on pharmacies.
Back in February, Colorado's Prescription Drug Affordability Board ruled the arthritis drug was unaffordable for patients right here in our state. And today, that same board voted to set a maximum price of $600 for 50 milligrams of the drug. I talked to a consumer group celebrating that win and pharmacists who are worried they'll be left to pay the difference. Lead technician at Wheat Ridge Professional Pharmacy, Ali DiLorenzo, knows how expensive some prescription drugs can be, not just for people who need them, but for the pharmacies that carry them.
It is a very expensive med. It's over $7,000.
DiLorenzo is talking about Enbrel, an injectable drug used to treat several autoimmune conditions. For 1 month, over $7,000.
Yes. And insurance companies don't really reimburse you.
In an effort to make prescription drugs more affordable, Colorado is the first in the nation to cap a prescription drug price, starting with Enbrel, $600 for 50 milligrams. Adults typically take that dose weekly. In a year, that comes to over $31,000. Data from 2023 shows insurance companies paid about $53,000 a year for each customer using Enbrel. Patients paid about $4,600 annually out of pocket. But since it was introduced in 1998, the drug's wholesale price has skyrocketed more than 1,500%.
This is groundbreaking.
Communications manager at Colorado Consumer Health Initiative, Priya Talang, calls the price cap a win for patients.
It's a bipartisan issue. Everyone has issues accessing and affording health care in general. This is just the start of so many consumer savings.
While this could ease the stress for those with chronic illnesses, DiLorenzo is worried about the impact the payment limit will have on pharmacies like her own. She says they're already losing money on most prescriptions, and this will likely be the same.
Taking a loss on a quarter of your scripts is not a business.
In March 2024, Amgen, the maker of Enbrel, sued Colorado's Prescription Drug Affordability Board. That lawsuit was dismissed. Amgen is appealing the district's court decision. Now it is anticipated there will be new litigation over the price of Enbrel now that Colorado has capped that cost. I'm in the studio tonight, Claire Lavazorio, Denver 7.
Now, over the summer, a new law took effect aiming to increase access to lower-cost prescription drugs here in Colorado. The new law strengthens the federal 304B program, which allows eligible hospitals to buy discounted drugs to serve more low-income and uninsured patients. Drug manufacturers can no longer restrict which hospitals or clinics get those discounts. The law also requires hospitals to publicly report how they use the savings. Now, supporters say this will help keep life-saving medications accessible across our state. And the Trump administration has delayed now that 100% tariff on some imported drugs. Now, the president previously threatened to impose the tariff on brand name or patented drugs that were set to go into effect Wednesday, but a White House official says the tariffs will not be levied while the administration evaluates companies' proposals to reduce prices and increase manufacturing here in the U.S. However, that official says the tariffs are still being worked on.